Our today's webinar is actually about one of the most important topics, which is on uh, GMC registration through the PLAB pathway. One of our most competent doctors, Dr. Ahmad Javed, who has recently cleared both PLAB 1 and PLAB 2, and he is currently working as a postgraduate resident in the Department of Pediatric Medicine at Institute of Child Health and Children Hospital, Faisalabad. He will be delivering the lecture, and I hope you hold on your questions. And at the end of the session, we will have a Q&A session. Then you can ask your questions in different languages. Even you can ask your questions in Pashto, Farsi, and any other language in Urdu or English. So we will give you time at the end of the session, but for time being, I will take the mic to our respectable Dr. Javed to start the presentation, and then we will take your questions at the end of the session. Dr. Javed, please take the mic and you can start your presentation.
The PLAB pathway is one of the pathways through which we can register ourselves and get a license to practice in the United Kingdom from the General Medical Council of the United Kingdom. All right. The PLAB pathway has various steps. We are going to talk about those steps. However, because of the shortage of time, I'm not going to go into much details of those steps, as each of those steps require a detailed presentation and lecture. I'm just going to superficially touch them, and inshallah, I will always be there to guide you people throughout in detail. All right. So before starting with the PLAB pathway, I'm going to just give a brief introduction to the GMC, and then we can start with the PLAB pathway. Dr. Salman, can you please move on to the next slide? All right. So what is General Medical Council? The General Medical Council is a public body that maintains the official register of the medical practitioners within the United Kingdom, Northern Ireland, and Wales. The United Kingdom, Northern Ireland, and Wales are collectively known as the Great Britain, and the medical institutes throughout the United Kingdom are controlled by this General Medical Council. The purpose, activities, and powers of this medical council include registering doctors in the United Kingdom, providing them with license to practice, and revalidating those doctors, and as well as setting standards of good medical practice and ethics. And along with these functions, it also controls the medical curriculum of med schools throughout the Great Britain, and it has a charitable status. Dr. Salman, next slide, please. Okay, so there are various pathways through which we can get registered with this medical council, and we can get the license to practice. All right. The first pathway, which we are going to talk about today in detail, is the PLAB pathway. The PLAB pathway is for the junior doctors, for the senior house officer level doctors. The other pathways through which medical practitioners can get registered with this medical council, I'm also just going to briefly talk about those pathways as well, because some of the participants might be the doctors who might be at senior level, and they can pursue these other pathways for registering with the medical council. These pathways include MRCP for the medical specialists. These are Royal College exams. After clearing these exams, you would be able to get a license to practice with the General Medical Councils, and you can get your registration, okay? So MRCP is the Royal Membership exams for the medical specialists. MRCS is for the surgeons. MRChem is the Royal College exam for the emergency medical specialists. MRCOG is for the gynecologists and obstetricians. MRCPCH is for the child specialists. The child specialists can take these exams of the Royal College and can get registration and licensing with the General Medical Council. The other is the MRCP Psychiatry for the psychiatrists, and etc. One other pathway, which I'm going to talk about, is the provisional registration pathway. Yes, General Medical Council does provide provisional registration as well. That provisional registration can be obtained through two routes. The one is the CPSP route. The CPSP is the College of Physicians and Surgeons of Pakistan. It provides scholarship MTI route through which you can do 2 years or 3 years training in Pakistan, and the remaining of your training you can do in the United Kingdom. And the GMC for that will provide you with a provisional registration. That provisional registration can be converted into permanent registration as well by the end of your training and by the end of clearing all the relevant exams. The next is the Royal College MTI route. That is for international candidates. It is controlled by the Royal College in Edinburgh. And through this pathway, you can do 2 years training or 3 years training in your home country, and the remaining of your training you can do through a scholarship provided by the Royal College, and you can do that training in the United Kingdom. For that, the General Medical Council will provide you with provisional registration, which can be converted into permanent registration as well by the end of your training. All right. So, Dr. Saman, next slide, please. Okay, so our main topic today is the PLAB pathway, the pathway which is for junior doctors. All right, the PLAB. Let me introduce you, or let me tests. One is the occupational English testing, and the other is the IELTS. The second step of this pathway is the PLAB 1 examination. The third step is PLAB 2 examination. The fourth is the EPIC verification of degree and house job certificates. The final step is the registration and licensing step with the General Medical Council. Okay, Dr. Salman, next step. Next slide, Dr. Salman. All right. So occupational English testing is the test which I usually prefer and which I usually recommend to all the junior doctors. The first benefit and advantage is that it is easy comparative to IELTS, and it can be easily cleared. It's possible to acquire the required bands for the General Medical Council easily. All right. It has 4 subtests like IELTS. It has listening, reading, writing, and speaking. I'm only going to talk about those venues which are easily accessible for us Afghans, as we usually face travel restrictions and it's not possible for us to travel throughout the world. I'm going to talk about the pathways that the venues that are easily accessible to us. Those include obviously our neighboring country, Pakistan. Pakistan has venues like Lahore, Islamabad, and Karachi, where this test is conducted every month, 3 times every month. Okay. And obviously, if some of you can travel to Dubai, this test is conducted in Dubai as well, and it's conducted throughout India and a lot of provinces there in India as well. Okay, the cost of this exam is 587 Australian dollars. All right, which is almost around 384 US dollars. The GMC requirement for this test is B grades in all the subtests in one go. In one sitting, you have to take B grades in all the 4 tests of listening, reading, writing, and speaking in one test. Okay. Next slide, Dr. Saman. All right. The other one is the IELTS. IELTS academic has 4 subtests as well: listening, reading, writing, speaking. The venues include IELTS is conducted in Kabul as well, but unfortunately OET is not conducted in Kabul at the moment. The other venues include Peshawar, Lahore, Karachi, Islamabad, and Pakistan. It's also conducted in Dubai and throughout India. The cost is less compared to OET. It is around $215 US to $310, depending upon the location. And the GMC requirement is a bit tough here compared to OET. The GMC requirement is an overall band of 7.5 across all 4 subtests, like reading, listening, writing, and speaking in one go. And in each of the subtests, the band should not be less than 7.0. It should not be 7.0 in any of the subtests. Okay. And obviously, it's a bit tough when it comes to writing. IELTS writing is difficult. So I'm going to compare both IELTS and OET now. The reason I'm preferring OET and recommending OET a lot is because it's overall medical based. Okay, the whole language in which you are going to be assessed will be medical language. The listening will be medical related. The reading, writing, speaking, each and everything will be medical related. So it's easy for us medical practitioners to get it cleared compared to IELTS, which has a broad range of subjects, and which include statistics, economics, journalism, political science, and a lot of tough subjects which we are not familiar with. Okay. The difference is IELTS are of 2 types. One is IELTS academic, IELTS UKVI. IELTS UKVI is for the visa requirement. The OET is only for healthcare professionals. It has 12 versions. Rest of the subtests are same. Might be a little bit of timing difference, but the subtests are usually the same. And IELTS are usually conducted through academic subjects. OET is usually conducted in healthcare related subjects. Okay, IELTS on scoring basis out of 9, while OET has bands A, B to up to E. IELTS is accepted by various universities, regulatory bodies, immigration authorities throughout the world, while OET is also accepted by healthcare regulatory bodies and higher education for healthcare educators throughout the world. Okay, and yeah, we can move on to the next slide, Dr. Saman. Okay, so the other differences include IELTS is a bit cheap. I know it's cheap, but it's difficult to clear it. All right, you will end up with almost 2 to 3 attempts if you are going to go for IELTS. Okay, so it's better to just go for one attempt, prepare properly accordingly, and just get done with OET. Okay, I know OET is a bit more expensive, but it is easy comparative to IELTS. Okay, you can easily get it cleared as compared to IELTS, and you can save up on money. If you are going to go for IELTS just because it's cheap, you will end up with almost 2 to 3 attempts, and by the end of the day you will spend the same amount of money which you are going to spend on OET. All right, so in IELTS it is very less chance of getting 7.0 in writing, because the writing is usually tough for us medical practitioners, while in OET the writing is wholly based on our medical field. All the letters which you are going to write in OET are either discharge letters, or either referral letters, or transfer letters, which we are very good familiar with in our day-to-day life of medical practice. Okay, and you know, there is something else which I wanted to talk about. Some people might have not done house job, and they might have gone to UK. So if they are going to do house job in UK, the UK hospitals require FY2 standalone. FY2 standalone, you can do your house job in UK as well, but for that you have to do FY2 standalone there in UK. And that the GMC is going to ask for a specific band. Okay, in that you have to get more than 400 in each of the subtests of OET, and you have to get a score of 7.5 or more in each of the subtests of IELTS. Okay, it is difficult to get 7.5 in each of the subtests of IELTS compared to 400 compared to getting 400 in OET. So those people who are going to do house job in UK as well, they should opt for OET, because it's easy to do and get 400 marks above in all the subtests of OET. And yeah, the rest of the things are fine. I have already explained them. Dr. Saman, we can move to the next slide. Okay, as I said, there are 12 versions of OET. The OET test is conducted for medical practitioners as well, and alongside medical practitioners, nurses, pharmacists, dentists, physiotherapists, radiographers, speech pathologists, dietitians, occupational therapists, optometrists, podiatrists, and veterinary medical specialists can also take their English requirement test in OET, and it's easy for them to compare. It's easy for them to get it clear as well, and they can get registered with their relevant licensing bodies in the UK and Ireland, and they can start their practice there as well. Dr. Saman, we can move to the next slide. All right, so the first step starts with making an account or online account in the OET. Okay, you have to type oet.com in the Google, and there you have to make your online account, online profile in the OET. This is the page where you can, you know, sign up for the for your online account. And after getting signed up, you can, you know, share your personal data there. You can place your pictures there. You can create an email address for yourself there, a password there. And then after that, you can easily log in and log out from your profile. That is the place where you will you will be able to book a test for yourself, and you can, you know, start with the rest of the procedure. Dr. Saman, we can move on to the next slide. This is how in OET result looks like. This is the typical result which is acceptable to the General Medical Council. As you can see, in all 4 subtests, listening, reading, speaking, and writing, this candidate has gotten more than 350 marks. He has achieved the required B band in all the 4 subtests in one go. Okay, this is the typical result that is acceptable to the General Medical Council, and that is how your result should look like. This candidate has taken his test in the Lahore Center, and he has passed it, mashallah. We can move on to the next slide, Dr. Salman. Okay, the materials which are used for taking this test include a JSON file. JSON file is a file that contains somewhere around 25 reading subtests, 25 listening subtests for you to practice on. There is another PDF file of 50 A-grade sample letters as well. It is a PDF which contains 50 A-graded letters. Those letters include discharge letters, referral letters, transfer letters, emergency transfer letters, all sorts of letters that might be used for you in the OET test. There is another option which I used most of the time, and I personally prefer are the Steve videos. Steve videos you can find on YouTube. For that, you have to type OET online or OET official on YouTube, and you can easily find Steve videos. He's a brilliant teacher. I myself used to use his videos when I was preparing for my OET exam back then. Another channel which you can use on YouTube as well is E2 OET. It's also quite a useful channel. And there are a lot of listening practice subtests on YouTube, and there are also many apps which you can find in Google Play Store as well. Okay. And along with these, there is a very big group in Facebook as well, which is known as OET Pakistan. You can type it in the search box of the Facebook, and you can find this group. There is so much of material present in this group. There are a lot of doctors there for you to practice with, for you to take guidance from. And a lot of Indian groups are present on Facebook as well. Okay, for that, you just have to search them on the search box of Facebook. The materials and sources can be downloaded from the media file sections of all these groups, which I mentioned. And there are a lot of online subscriptions and online academies available as well. And there are some physical academies for you to join as well. They can be found in Islamabad and Lahore. But I personally recommend that you don't join any of these academies, or don't offer any of these online subscriptions. They are just doing their business. It's quite an easy exam for you to crack. It just needs self-study, self-preparation for a month or two, and you will be able to crack it out. I myself joined no online subscriptions. I didn't join any sort of physical academies. I just studied with myself, and I was able to clear it with self-preparation. All right, we can move on to the next slide, Dr. Saman. Okay, this was the channel I was talking about. This is E2 OET. You can search it in the search box of YouTube. You will easily find this channel, E2 OET. You can watch all their videos, and you can take a whole guidance from their videos regarding all the subtests, including reading, listening, writing, speaking. These are very brilliant OET mentors. They are all Australians, and they can give you very up-to-date knowledge about the OET exam. Okay, we can move on to the next slide, Dr. Saman. Okay, one next slide, sorry. Yes, Steve OET, this is the person I was talking about. I personally recommend this person a lot. He's brilliant when it comes to OET preparation. He's Steve, he's from Australia, and he has this channel on YouTube. The channel is known as OET Online. You can find his videos regarding all the subtests of reading, writing, speaking, listening. He is very excellent, and I myself watched all his videos. I myself used to sit for his online videos, and it was brilliant. We can move on to the next slide, Dr. Saman. Okay, this was the group I was talking about, OET Pakistan. You can find it in the search column of the Facebook. You have to join this group. This group has more than 30,000 participants. There are a lot of doctors for you to practice your speaking with, to practice your reading, writing, and listening with. And this is the media and the file section of this group. You can visit the media and the file section of the group, and you can find all the material there regarding reading, writing, listening, speaking, and everything. All right. Next slide. Okay, so after when you get done with the OET, and you are able, and after getting the required bands for the GMC, you can make a profile for yourself in the GMC, General Medical Council website. For that, you just have to type the General Medical Council online on the Google, and you will be directed to this page. Here, the red mark shows how to create a GMC online account. You have to just create your online account. Here you have to give all your personal data, including your pictures and every thing. And after that, you will be able to get registered with the General Medical Council through an online account. And then you can always enter your account through GMC reference number, which you will be provided with through a special email. And also you can type any password there. Next slide, Dr. Saman. Okay, so After when you are able to make an online account for yourself in the GMC website, the GMC will ask you to upload your OET result. Okay, you have to upload your OET result in the GMC account of yours. The GMC will take some days. They will verify your OET result. They will contact the OET Council in Australia. They will verify your OET result from them, and after that, they will let you know that your test is accepted, and they will allow you to book PLAB 1 dates. Okay, as long as they are not able to verify your OET result, they will not allow you to book PLAB 1 date. As soon as they verify your OET result and gives you a test accepted status, then you will be able to book a PLAB 1 seat for yourself. Okay, next slide, Dr. Saman. Okay, so you have to regularly follow the GMC General Medical Council Facebook page. They usually give updates about the release of PLAB 1 seats. Okay, you have to regularly follow their page for updates. And this is how an update from the GMC will look like. As you can see, the GMC gives an update of releasing places for August and November of 2023. This was their recent update for their test dates in August and November months. This is how you will know about the exact time and date of the release of the test places. Okay, as you can see, they have given Saturday, the date 10 December 2022 at 10 a.m. This was the date and time for them to release the PLAB 1 seats. You have to regularly follow them, and you have to note this exact time and date for you for registering a PLAB 1 seat. Okay, and you have to be there on this exact time and date in your online GMC account for you to pick a PLAB 1 seat. Okay, next page, Dr. Samar. Okay, so when you enter your GMC online account at this specific date and time, this is how PLAB 1 seats will be released. This is how you will see in your online GMC account the places for you to pick for your PLAB 1 seat. As you can see, the PLAB 1 is conducted throughout the world. It is conducted in Australia, Bangladesh, India. But for us Afghans, we can easily travel to, or the venues which are easily accessible for us include Pakistan. The PLAB 1 is conducted in Islamabad and Karachi. I myself took my PLAB 1 exam in Karachi, and it is also easily accessible to us in Dubai as well. We can also take this exam throughout India. India has more than almost 15 to 16 venues throughout each and every province in India as well. And I think it's possible for us to travel to India as well for taking this exam. Okay, so let's talk about PLAB 1 exam in detail. So after when you make your GMC online account, and after uploading your OET result, and after verifying your OET result from the GMC, and after booking a PLAB 1 seat for yourself, the cost of the PLAB 1 is almost around £250. I think it's £255 nowadays, including some taxes. And the materials which you can use for your PLAB 1 preparation include PLABable QBank online subscription. This is a QBank which you can find in Google. This is an online QBank which you have to subscribe, and you can use their material. It has theory material, and it has online MCQs for you to solve. You can prepare for PLAB 1 from this QBank. The next QBank is MedRevisions QBank. MedRevisions has almost somewhere around 5,000 MCQs, multiple choice questions from which you can prepare, and it has theory for all of those 5,000 MCQs which you have to read. And the third one is PLAB-Keys. PLAB-Keys is a sort of online bank of theory material. All right, theory material for all the subjects that are covered in PLAB 1 exam. So these are the three sources which are mostly used by the medical practitioners throughout the world while preparing for this exam. Next slide, Doctor. Okay, so let me talk about the structure of PLAB 1 exam in a short review. It has somewhere around 180 single best answer questions. Okay, and the one for 180 you have a duration of 180 minutes. So per MCQ you have time of 1 minute. You have to solve each MCQ in 1 minute, because you have 180 MCQs to cover in 180 minutes. All right, you will be given a short booklet of A4 size paper. It will be a thick booklet, because it takes a lot of pages to cover 180 MCQs. And in this booklet there will be ECGs, pictures, and all sort of medical material for you to look at. And along with this booklet you will be given another answer sheet paper. You have to read this booklet and solve your MCQs on the answer sheet. Okay, the result will take somewhere around 45 days. As I said, PLABable, mid revisions, yeah, one thing else I wanted to talk about, the online cubings which I mentioned, PLABable and mid revisions have online mocks as well. Okay, you can generate mocks for yourself as well. PLABable has somewhere around 16 mocks, online mocks, in which you have to solve 180 MCQs in 180 minutes. Okay, so this is a sort of a, this is a sort of a rehearsal for you in order to get prepared in a better manner for PLAB 1 exam. Okay, so the next slide I was talking about is the blueprint. Okay, so some of you might be confused regarding the different sort of topics and the different sort of systems for you to prepare for the PLAB 1 exam. For that purpose, the GMC has placed a blueprint in their website. Okay, you have to search for the download the blueprint, PLAB blueprint from GMC on the Google search box. You will be directed to this page and you can download the PLAB blueprint, and you can find all the subjects and all the topics that are required for you to cover for PLAB 1 preparation. Okay, this is one of the page I have taken from the blueprint, the PLAB blueprint. I had downloaded from the GMC official website. So as you can see, it has blood and lymph, cardiovascular, child health, digestive systems. It gives you a basic idea which topics to prepare, which subjects to look at, which things to study. Okay, so it has, the PLAB blueprint is a whole file. It has a lot of pages. I've just taken a one page as a sample purpose. Okay, so you have to cover all these topics, all these subjects in order to be prepared in a better manner for PLAB 1 exam. So this is how the answer sheet of PLAB 1 will look like. They will give you this single paper answer sheet for you to solve your MCQs on. You have, your name will be already written there. The city in which you are taking this exam will be written there. The date will be mentioned. You just have to write your GMC reference number there. You have to use lead pencil, 2HB pencil. Okay, so they have shown the exact manner in which you have to solve your MCQs. You have to just fill in each of the box in a square manner by completely circling it with a pencil. It will have 180 MCQs for you to solve, and you just have to, on one side you have to look at the booklet, and on another side you have to keep continually solving your MCQs on this answer sheet. All right. Okay, yeah. Nowadays, PLAB exam has gotten a bit tough. So I would recommend a preparation period of at least 3 to 6 months. Okay, you have to properly prepare it because they have made it quite tough nowadays. Okay, so the next step after clearing your PLAB 1 exam, after receiving your result after 45 days, the next step is the United Kingdom visa process. Okay, you have to book a visa for yourself. You have to take United Kingdom's visa because the PLAB 2 exam is only and only conducted in the United Kingdom. It's only conducted in Manchester. You cannot take PLAB 2 exam anywhere else in the world. Okay, so the required documents for you to apply for a UK visa include your passports. You have to upload your original Tazkira card as well. You have to show a bank statement for at least 6 months. Okay, you have to officially take out your bank statement from the bank. It has to have the record of previous 6 months. All the transactions in and out should be mentioned in your bank statement. Okay, an account maintenance certificate is also provided by your bank as well. You have to, if you are married and your spouse is living in your home country, you can show your marriage certificate as well. The reason I'm emphasizing on this is because it improves the chance for you to get a UK visa. Okay, it is a sort of a bond. Okay, they will see that you are going to return back to your spouse, so they will, it improves your chances of getting a visa. PLAB 2 registration print, which you will receive from the GMC, a receipt of the fee deposited for PLAB 2, which will also be issued to you through an email by the GMC after when you book a PLAB 2 seat for yourself in the GMC online account. Okay, you have to show your GMC registration as well. You have to upload your OET exam test as well. You have to show all your medical documents, including MBBS, your registration with the PMDC or the AMC, your house job certificate as well. Some other documents include, if you are actively and currently employed, you have to show pay slips of your previous 6 months. You have to show pay slips so that the UK VI sees that you are employed and you have a good in and out through your of salaries coming to your account. You also need to show an employment letter from your hospital in NOC that your hospital has no objection. the hospital has to mention the time period in which you will be absent from your duty, and it also has to show that the date on which you will be back for your duty in the hospital, an employment card of your hospital as well, appointment confirmation if you have that as a trainee or employee. You also have to show your parents' passports and tazkira as well, your wife and passport and tazkira if you are married, your proof of residence address as well. It can be shown through any bill, official bill which you receive from the municipal authority, electricity bill, gas bill, anyway, anything might work out. You also have to type a visa cover letter in which you have to start from scratch regarding your whole introduction, regarding your background, your family background, your academics from school up to university, up to your employment. You have to mention each and everything in this visa cover letter. You also have to mention your travel itinerary for how many days you will stay there in the UK, the hotel which you have booked for yourself, your whole plan in the UK regarding which date you are going to go to the Manchester and on which date you are going to take the exam. Okay, you have to type everything in this visa cover letter. You have to show your travel history in your application as well. A good travel history improves the chance of you getting a UK visa. If you have a travel history, do mention it. If you have traveled to countries like Dubai, Pakistan, etc., you need to show that travel history as well. In UK VI online application as well, which you can fill there in their online website. Other academic documents, proof of lands and properties. If you have any lands or properties on your name or your father's name, you have to show them as well. It improves the chance of you getting a UK visa because you can show to them that you have quite a stable background in your country and you're not going to stay there in UK, or you're not going to violate their travel rules, or you're not going to become a burden or apply for asylum or anything like that. And sponsorship letters and documents. If you have any sponsor in UK, anyone among your families who can sponsor you or who can who can recommend you for this journey, you can show their documents as well, their bank statement, their passport, and a sponsorship letter for them stating that they are sponsoring you and they will be responsible for any problem in your journey. And they also, it improves your chance of getting a UK visa if especially they state that you're not going to become a burden on the UK's economy. Okay, this is where you can start your UK visa application. You have to write UK VI on the Google's search bar. You will be directed to this page. You can make in your online account for yourself in the UK VI website. And this is the first step where you can start your visa application from. The rest of the steps will be mentioned here. Okay, so after getting a UK visa successfully, inshallah, you can find a room for yourself there in the UK. This is an app which you can download from your Play Store. It's called Spare Room. You can look for rooms, flats, and properties throughout UK. You can find a room for yourself. You can book it. You can go there and stay there while you will be staying there and preparing for your exam. This is another app which you can also download from the Play Store. It's called Airbnb. You can also book a room or a flat or a hotel or anything like that for yourself there while you will be staying there in UK and preparing for your PLAB 2 exam. Okay, now we are coming to the PLAB 2 exam. You will be able to book your PLAB 2 exam through your GMC online account. Okay. After clearing your exam, the GMC online account will allow you to book a PLAB 2 date. The PLAB 2 dates will become visible for you. And the venues, as I said previously, it is only and only conducted in Manchester, United Kingdom. It's not conducted anywhere else in the world. There are two buildings there. One is the Hardman Square, Manchester, United Kingdom. The other is Hardman Street, Manchester, United Kingdom. Okay. The cost of this exam is around 9-10 GBP pounds. You might face a bit of difficulty while booking this exam. As you can see, it costs a lot. Okay, and the normal debit cards might not be able to transfer this amount to the GMC. For that, you have to use a credit card. Okay, you have to use a credit card which have the amount to cover this expense of the PLAB 2 exam. Or if you have anyone in the UK, anyone among your relatives, they can easily book it for you through their UK bank accounts. Okay, it's not a big issue for them. But usually it becomes a big issue if you are going to book it through a bank from Afghanistan or a bank from Pakistan. Okay, for that you will be needing a credit card. But it's quite easy for you to book it if you have any relative there in the UK, and you can use a UK bank account for it. Resources include NHS, National Health Services guidelines, Oxford Short Handbook, and a good medical practice PDF, which you can find from the GMC online website. Okay, there are a lot of academies there in the UK. Dr. Musobi Academy, Dr. Samson Academy, Dr. Hamid Salihi is an Iranian, has academy there, also functions for the PLAB 2 preparation. You can book any academy among these, okay? So let's talk about the structure of PLAB 2 exam. PLAB 2 has a total of 18 stations, okay? Out of these 18 stations, 2 are resting stations, where you will be allowed to take a bit rest during your exam, and 16 are active OSCE stations. Each station has a duration of 8 minutes, okay? And each station is covered out of 12 marks. It is like scored out of 12 marks. And these 16 stations will include interactive stations with the patient. There will be phone call stations as well. There will be video consultations as well. There will be a phone call placed. There will be a telephone placed in the station where you will be talking with the patient on call. And there might be a video consultation as well, where you will be talking to the patient on video call, okay? The practical and procedure stations include, there is a cement management station. You will be passing an IV cannulation as well to a prosthetic arm. You will be taking an ABG, arterial blood gases sample as well from a prosthetic arm, a blood sampling as well. There will be a station for passing Foley's catheter to the patient as well. The patient will be a dummy patient. You will be taking a PAPS cervical smear from a dummy as well for cervical sampling. You will also be doing a proctoscopy as well on a dummy. There will be a station of subcutaneous injection as well, where you will be passing a subcutaneous injection on a dummy patient. The examiner will be sitting there in the station as well. There will be a station about EpiPen as well, where you will be teaching a mother about EpiPen. EpiPen is a sort of a device which is used for emergency transfer of adrenaline in an anaphylactic shock patient, especially those who suffer from severe anaphylactic reactions and all that. There will be a station about teaching a medical student regarding taking a urine sample through urine dipstick as well, or a sample of taking a blood culture from a dummy patient as well. There will be different teaching stations as well, like teaching an ECG to a medical student. There will be a student there sitting in the station who will greet you like a normal student does in our hospital day-to-day life. Or you will be teaching a BLS as well to a medical student. The examiner will also be sitting in the room. The examiner will not be talking. He will be silently, or she will be silently looking at you, noticing you, taking out your mistakes, noticing everything about you, okay? There will be examination stations as well. You will be examining a patient's inguinal-scrotal region, rectal examination, testicular examination, abdominal examination, antenatal examination of a pregnant patient, eye examination, ear examination, prostate examination. All these examinations you will be doing on dummy patients, okay? And the final are the cement stations as well. I'm going to talk about the cement as well. So the passing criteria, you have to, as I said previously, there are 16 stations. You will be passing at least 10 stations out of 16 stations, okay? You have to pass at least 10 stations. If you are going to pass only 9 stations, you will be considered a failed student. You need to pass at least 10 stations out of 16 stations. And an overall score on that date of exam. It's not only about passing 10 stations. You have to take a score that will be above the overall pass score on that exam date, okay? There will be an average passing score on that date, and you have to take a score more than that score, which will be the average score of pass, okay? And out of these, as I said, each station will be marked out of 12 marks, okay? So out of 12, 4 will be for the data gathering and history taking, and 4 will be for your interpersonal skills, and 4 will be for the management, okay? So out of these 12 marks, you have to take 4 marks for your history or data gathering, and 4 for your interpersonal skills with the patient, how good you talk to the patient, how fluent you are while talking to the patient, how good you have interpersonal skills while building a rapport with the patient. And the last is 4 marks will be for your clinical management of managing that exact station, okay? Each station has a separate examiner. There will be 16 stations, and each station will have 1 examiner. So there will be a total of 16 examiners sitting in each and every station, okay? And the following skill set you will have to portray. You have to show how good you are in consultation, how good you consult with a patient, how efficient you are in taking out a diagnosis of that exact station, how good you are in examining that patient, and how good you are while taking out your findings and explaining them to the patient in a normal language, okay? In a day-to-day language, not in medical terminology, okay? And how good you focus on the patient's active issues, the issues that require prompt management, okay? And you have to show them that you are fluent in English as well, and you have to show good English capabilities. And you have to, the thing that matters the most is listening. You have to show them that you have active listening ability. Okay, you don't have to just talk without listening to the patient. You need to show active listening skills, that you are actively listening to the patient, you are picking what he's or she is saying to you, and you are discussing those things back. Okay, and your management abilities, how good you are building a rapport with a patient, and how good you are in managing your time. You have to do all these things. You have to show all these skills and abilities and cover them up in 8 minutes, in exact 8 minutes. So it also depends on your time covering ability as well. Okay. Okay, so as I was saying, there are various academies there in the UK where you can prepare for your PLAB 2 exam. I myself chose Dr. Mo's Academy. He's an Egyptian doctor. He belongs to the Egypt. He has this academy. It was, in my time, it was present in Liverpool. I had gone there to Liverpool. I stayed there for a month and prepared my PLAB 2 in his academy. But recently, I think he has shifted his academy to Crewe. There is another region named as Crewe. He has shifted his academy there. You can join his Facebook page. This is his Facebook page. It has almost around 12,000 members. You can join his Facebook page. There are a lot of doctors there for you to take guidance from. You can contact their admin as well. They will give you detailed information which you need about this academy and how you can join this academy. So this is how his academy looks like. This is Dr. Mo. He's an Egyptian doctor, and these are all his students who have gone to his academy, and they are preparing for PLAB 2 exam in his academy. Okay, so this is the Hartman Square in the Manchester, United Kingdom, where you will be taking your exam, PLAB 2 exam. This is where you will go to their reception, General Medical Council, on the day of your exam. So this is how the stations will look like. Okay, there will be 18 stations. Out of 18, 2 will be resting stations, 16 will be active stations. This is how each station is designed there. You will be standing outside. A time of about 1.5 minutes. 1.5 minutes will be given to you for you to read this scenario. The scenario is given outside the station. You can see all these students, they are reading the scenario there. You will read the scenario. You will find out, okay, the patient introduction will be given there in the scenario, the patient's active complaints and issues, and every detail about the patient will be given there. You have to read everything, and then you have to enter the station upon, when the ring bells. And then you have to go and sit and talk with the patient. Okay, so this is the inside of the station. As you can see, there will be two people inside the station. One will be the examiner. The examiner will not be talking to you. The examiner will be silently sitting there. He will have a sort of a iPad or something, just to note your mistakes or to give you score. And a patient will be sitting there as well. You just have to go there. You have to loudly pronounce your GMC reference number to the examiner. You have to tell your name to the examiner, and then you have to give your introduction to the patient and start interacting and consulting with the patient. You have to take history from the patient. You have to gather your data. You also have to show active listening skills. You have to show active consultation abilities, active interpersonal skills, and explain everything to the patient, especially the red flags, especially the things that need urgent management or urgent attention. And you have to give management to the patient as well. All this you have to do in exact 8 minutes time. And after 8 minutes, the ring will bell and you will be moving on to the next station. Okay, so these are the examination stations. As I mentioned previously, there will be a lot of examination stations as well, in which you will be doing abdominal examination. As you can see, these type of dummies will be present there. Obviously, you will not be allowed to examine on the patient. Okay, you just have to talk to the patient. You just have to take history from the patient. You just have to find out what the patient has. Now, I'm going to talk about one of my station. When I entered the station, okay, outside the station, there was this scenario present, and in that personal details about the patient was written, and also has active complaints. He had some sort of abdominal pain, and it was written there, I have to go and talk to the patient. The patient has abdominal pain and he has fever and all those things. When I entered inside, there was this male patient sitting inside the station. Along with him, there was an examiner sitting in one corner as well. And when I started talking to the patient, I introduced myself. I also made him introduce himself. And when I was taking his history and gathering my data, so he said that he has abdominal pain. The pain is in right hypochondriac region. He also has fever with this pain as well. And especially it gets worse when he takes some sort of fatty foods and all those things. Okay. And after that, I started asking about the site, character, onset, and all those things about the pain. So after talking to the patient for a while, after when you gather your enough data and you are sure that you have gotten your diagnosis, you will tell the patient that I'm going to examine you. Okay. He will tell you, sure, no problem. Then you move on to the dummy. Okay. You will be doing the examination on the dummy. And when you do the examination, then you will come back and sit with the patient. And then you are going to tell the patient that I think you have acute cholecystitis. However, we are going to run some further tests and all those things. You have to provide the management to the patient then. Okay. So moving on, this is how a cement station will look like. Some of the students might not be familiar with. Cement is a sort of a patient. Okay, this is how a cement station will look like. It is a dummy, but it's a talking dummy. This patient talks. Okay, he has feelings. He talks to you. He tells you about his complaints. He tells you about his active issues. And when you are going to examine this patient, you will be able to take his blood pressure as well. Yes, this dummy has active blood pressure. This dummy has active breath sounds as well. He has active cardiac sounds as well. You can feel his pulse as well. Okay, you can, it's like a normal patient. Okay, but it's a robot. It's a robot. There is a voice coming inside of it. So you have to, you have to enter inside this screen attached where you can see his vitals as well. This dummy will have some sort of active issue. You have to find out that active issue by taking his history, gathering your data, and then you have to move on, examining him, and then you have to provide him with the management. There will be a whole tray present there, emergency tray present there. You have to take out medications from that tray, and you have to actively manage this SIM-man. Okay, my SIM-man was suffering from PPH, postpartum hemorrhage. It was a pregnant female patient who had just delivered a baby, and she was having postpartum hemorrhage, and she had gone into hypovolemic shock, and there was blood present all throughout her legs. So this is how a SIM-man station can come in exam. So this is the dummies I was talking about. There will be this dummy present, on which you will be doing your blood sampling. Yes, this is a prosthetic arm, but blood actively comes out of it. Okay, and these are the vials present. You have to fill up the vials. You have to know which vials you have to fill. Okay, for serum you have to know which vials to pick. For blood, which vials to pick. And for platelet and clotting things, which vials you have to use. You have to know this thing, and you have to fill up those vials. You have to label them, and you have to place them, and everything should be done in a sterile manner, in a quite a gentle manner, and professionally. Okay, this is how blood will come out of the prosthetic arm. You have to show this. Okay, so you have to take care of the sterilization as well. You have to show that you are a professional doctor and you are good with the hygienic skills, and although you have to clean him, this candidate hasn't done it properly. Okay, so this is how the air examination station will look like. There will be a dummy present. You have to examine him through or her through otoscope. Okay, there. I know this is a prosthetic dummy, but when you look inside, there will be active findings in her ear. Either her tympanic membrane will be ruptured. Either there will be pus filled there. Either there will be, some sort of issue going on inside there. Either will be otosclerosis or something like that. You have to pick that finding, and then you have to sit with the patient. You have to explain your findings to the patient. You have to provide management to the patient, and that is how your station will go. This is the eye station in which you will be examining the eye of the patient. Yes, it looks like a prosthetic dummy, but when you look inside through this ophthalmoscope, you will be able to pick findings there inside the eyeball. There will be either a bulging optic disc, or there will be rupture of retina, or there will be like diabetic retinopathy, hypertensive retinopathy findings. You have to pick those findings. You have to explain them to the patient in common simple language, and you have to provide the management of that findings as well. exam pattern. I was not able to find the recent exam pattern. Previously, there used to be 18 stations, but nowadays there are only 16 stations, and out of those, 2 are resting stations. So total 16 stations and 2 are resting stations. So a total of 18 stations are there. As I said, there will be 12 marks for each station. Each station will be scored out of 12 marks, and out of those 12 marks, 4 marks will be given for the data gathering and history taking. 4 will be for your clinical management, the management you are going to provide to your patient, and 4 will be your interpersonal skills, how good you are in talking to the patient and doing consultation, how good you are in active listening to the patient, and how good you are in picking the things which need active and emergency management. Okay, a total score will be given there. Dr. Saman, a previous slide, sorry. As you can see, there is your total score. Your total score below is 134. Okay, 134, and along with 124 there is the pass score needed. The pass score is the score that was average score on that day. Okay, so the average score on that day is 133. Out of all the candidates who had taken the exam on this specific day, the average score is a pass score is 133. So you have to take a score more than 133. It's not only about passing 10 stations. Your score has to be more than 133 to get a complete pass or to get cleared in the PLAB 2 exam. Okay, so this is how it goes. So these are the things which the examiner will be noticing in you. The examiner will not be talking to you. The examiner will be very silent. You have to consider him as nobody is present in the station, that the station is empty, just a patient is there. Okay, the examiner usually sits in one corner of the room. He will have an iPad sort of thing with him, and he will be noticing your mistakes. Okay, what he's going to be focusing on is the consultation. Okay, he will be looking at your consultation skills, how good your consultation skills are, and he will be giving you marks there. And then he will see that whether you have picked a diagnosis or not, and also he is going to see your examination skills, how gently you examine the patient, how professionally you are while conducting your examination, and how vigilant you were while picking up your findings, and which issues you picked, and how good you were while explaining those issues and those findings to the patient, and whether or not you showed active listening to the patient or not. What happens is sometimes the patient tells you that he is diabetic. Okay, and later on, when you are going to manage that patient, you do not focus on his diabetes, or you give a sort of a management which contradicts his diabetes or makes his diabetes worse. So this is where your active listening comes into play. Okay, because you weren't able to pick that diabetes of the patient, and you missed it in your clinical management. So the examiner is not going to give you marks for your active listening. And finally, your management and your time consuming ability, how good you are while managing your time, and your rapport building with the patient, how friendly you are, how gentle you are, how good you are in picking up. When the patient is sad, you have to show sadness. When the patient is happy, you have to show happiness. When the patient is excited, you have to show excitement. This is what rapport is. Okay, so after getting done with your PLAB 2 examination, after clearing your examination, the final step is the GMC registration process. Okay, the GMC registration process is quite a bit lengthy. It's a bit time-consuming process. It starts with the EPIC verification. Okay, you have to verify your degree. You have to verify your medical degree. For that, you have to open an online EPIC account. Okay, you have to type on the Google EPIC online account. You have to build an online account for yourself there. The EPIC will send you a sort of a identification form. Okay, all your personal details will be written on that identification form, which will be sent to you by the EPIC. Okay, what you have to do is that you have to book a notary cam with another website. The website is known as Notary Cam. You have to build another profile there on the Notary Cam. Okay, and you have to take an appointment with a notary officer. The notary officer is a sort of law officer. He is a sort of or she is a sort of an advocate. Okay, you have to take an appointment with that law officer, and the law officer will come online to you. Okay, and when your appointment comes, the law officer will come online through the Notary Cam. The law officer will tell you to show your passport to him or her. You have to show him or her your passport, and also you have to show him or her your degree. You have to show him or her your face. The Notary Cam officer will note everything. He will look at your face, he will look at your passport and the details under your passport, he will look at your medical degree, and then he's going to form your EPIC identification form, which will be sent to him by the EPIC. Okay, he's going to sign and stamp it. So this is how your degree, your picture and your passport gets verified. Okay. Also, you have to upload your credentials to the EPIC website as well, your primary medical degree, your house job certificate, or your postgraduate experience certificate. What the EPIC will do, the EPIC will send those credentials to your university, the EPIC will send that medical degree to your university, and it will also send your house job to the council of your home country, either Afghanistan Medical Council or Pakistan Medical and Dental Council. The EPIC is going to verify your degree from your university, and he's going to verify your house job and your license from your medical council. Okay, and then the EPIC is going to give you a pass status, or like a confirmed status or verified status. Okay, all this process costs, the EPIC registration costs around $80, $80 US, and each credential which you are going to verify, whether it's your degree or your house job, each credential is going to cost you $125 US. Okay, and $30 is for sending those credentials to the university and to the council. But nowadays it's all online process, so this $30 is not going to be deducted from you. The whole process might cost somewhere around $200 to $210 US. Okay, and the EPIC is finally, the EPIC is going to give you an ID, and that ID you have to send to the GMC. The GMC is going to contact the EPIC, and the GMC is going to take all the verified details from the EPIC, and after that the GMC is going to issue you a license and a registration. Okay, so in the GMC, after the GMC verifies your degree and your house job and your personal details through EPIC, the GMC is going to tell you to upload your recent professional experience over the last 5 years. Okay, or if it's about less than 5 years from the date of your graduation, you have to give all your details, what you were doing since the day you got graduated. Okay, all your active medical experience you have to mention there to the GMC. And I would strongly request you, I would strongly recommend not to show anything fake. Okay, never ever show anything you haven't done. Never ever show or write any experience which you haven't done, because the GMC are very vigilant in this. They are going to verify it from all their sources, and they are going to ban you for a lifetime from United Kingdom. Okay, the documents to be sent to the GMC, they will then ask for some documents from you, including your passport, your primary medical qualification degree, a certificate of good standing from the medical council with which you are registered, the PMDC for Pakistan graduates and AMC for Afghan graduates, in OET certificate, your house job certificate, and in case, as most of our Afghans have name issues. Okay, I myself have a name issue. My name is Dr. Ahmed Javed Nasratyar. However, on my degree, my name is only Ahmed Javed. So I was facing this issue with the GMC. The GMC was telling me that on your passport, your name is Dr. Ahmed Javed Nasratyar, while on your medical degree, your name is only Ahmed Javed. So they were like creating this mess for me, but then they told me that I have to upload a same person certificate. I made the certificate from my principal, the principal of my medical school. He issued me the same person certificate in which he had stated that this person by the name of Dr. Ahmed Javed Nasratyar on his passport, and Ahmed Javed on his medical degree, which is issued by us, is the same one and same person. These both credentials belong to the same person, and the principal verified it, and I uploaded that to the GMC, and my issue was solved. So the GMC has marked my name that I go by 2 names. One is Ahmed Javed and the other is Ahmed Javed Nasratyar. So my issue got resolved. I think most of the Afghans will come across this issue. Therefore, I'm giving guidance regarding this problem from start. And your transcript as well, and a payment of registration fee online, which will be £161. Okay, so I just I have made this slide for you to to easily understand the whole EPIC process. Okay, first of all, you have to open an EPIC online account in Google, and after that, an EPIC will give you an EPIC identification form, which they are going to send you through your email. In that identification form, your picture will be pasted there, and your whole personal details will be mentioned there by the EPIC. you have to get an appointment with a notary camp. You have to send that that exact same EPIC identity form to the notary camp officer. The notary camp officer is going to verify it, sign and stamp it for you, and then the notary camp officer is going to contact EPIC regarding you. Then you have to upload all your credentials, including your degrees and house job certificates, all there. The EPIC is going to send them to your university and the council of your registration, and finally they will verify everything, and then you can, any council with which you are going to get registered, whether it's GMC or whether it's Irish Medical Council or whether it's the United States Medical Council, they can easily verify your credentials and verify your personal details from the EPIC. This is how the notary camp process will look like. A notary camp officer will come online and he's going to look at your picture, he's going to look at your face, he's going to ask for your passport and your degree. You have to show it to him through your webcam, online webcam, and he's going to verify it. And this is the EPIC identification form, which he will actively sign there and stamp it with his official stamp, and he's going to forward it to the EPIC. Okay, so finally, you are done with the whole pathway and you have got your GMC registration and licensing. Now it's time for you to search for jobs, okay? For jobs in the UK, throughout UK. There are multiple websites, including Track Jobs, NHS Jobs, NHS Scotland. These are all the HSC, NES, NES, and RMP. These are the websites which you can visit through Google. You have to make an online CV there. You have to mention all your personal details there. You have to mention all your active medical experience there. And you can search for jobs there. All the hospitals throughout UK will be posting their vacancies there on these websites. You can send your online CV to each and every hospital who have posted their vacancies there on these websites, and you will be called for an interview through an email from that hospital, and you can take your interview with them and they will issue you a job. Okay, there are certain locum agencies as well. They can help you out in finding a job in UK or Northern Ireland or Wales. These include BDI Resourcing, RM Medics, Medics Pro, and Measly.com. You can visit these locum agencies, you can contact them, you can send them your whole online CV, and they can look for jobs for you throughout UK. Okay, so as I said, you have to build for yourself an online CV on these websites. The CV should be designed as per the job description and person specifications. Like each and every hospital who will be posting their vacancies there, each job will have their own job description and own person specifications. Okay. You have to design your CV accordingly. Now, let's suppose there is a hospital who has posted a vacancy, and in that vacancy, the hospital is demanding for 2 years experience in the relevant field. The hospital is demanding for a Royal College exam step you have played. The hospital is also demanding a BLS or ACLS certificate from you. You have to build your CV accordingly. Okay, you have to show the required things which the hospital has demanded for. Don't over-explain yourself in the online CVs. Don't undersell yourself as well. Be active. Like you have to, have good CV as per matching your person specifications. Dr. Salman, sorry, the previous page, sorry. Dr. Salman, I wanted the previous slide. Yes, sorry, thank you. Okay, avoid mistakes in your online CV, grammar or pronunciation. Don't write in essay. Just be short, be relevant, and yeah. For CV building, the things which you need to focus from now. Okay, obviously, CV building starts from now. Okay. I know it's the last stage, but it starts from now. You have to start working on your CV from now. You have to attend various online courses. You have to get various online certificates for your CV from now, okay? Because you have a lot of time. You have to work on your CV from now. These online websites in which you can, do online courses include BMG Learning and Future.com. You can do various online courses in multiple medical specialties and medical topics there. You can also do a clinical attachment as well there. When you go there to UK, you can send your CV to a hospital and do a internship there as well for a week or 2 or a month, and it builds your CV, it improves your clinical experience, it shows on your CV that you have an NHS UK experience as well. It improves your chances to land a job there in UK easily. You can also do ACLS or BLS courses from now. There are multiple foundations throughout Pakistan where you can book an ACLS and BLS courses for yourself and improve your CV through these courses. Active clinical experience is required. There has to be no gap in your CV. You have to be actively working in a hospital or a clinical setup so that it improves your chance to land a job there in UK. Yes, one thing else I want to talk about are the Royal College membership exams. If you have time, if you are spare, you have the finances, you can book a Royal College exam, which I mentioned previously, like MRCP exam, MRCS exam, any exam in your relevant field, MRCPCH exam. You can take this exam and mention them on your CV. It increases the chance for you to land a job there in UK. This is the website I was talking about. Welcome to Track. This is the Track Jobs website. You have to, make an online CV in this website. All the hospitals throughout the UK post their vacancies on this website. You can find their vacancies. You can send your online CV to them, and they will book an interview with you for the relevant vacancy. So for any further guidance, you can always contact me. I can be reached out through my email and contact number. My contact number is mentioned here through WhatsApp. You guys can contact me. All right. Thank you so much, and good night. I'm sure that it was a useful lecture for all of you. In case if there was anything you wanted clarification regarding it, I will always be there in WhatsApp. You guys can contact me anytime.